On your surgical day, expect to be with us about 2 hours. The actual surgery time is measured in minutes, but we keep you here for such a period on purpose. During the first half hour that you're here, we're going to have you come in, go over the informed consent, which is a document that tells you all the pros and cons of doing the surgery as well as risks. We want to make sure you get one more chance to really know that this is something that you want to do. Once you've signed the documentation, we're going to give you a Valium. Some people refuse a Valium, but I'd say the majority of people want to take the Valium to kind of be comfortable while they're with us. It can take about a half hour for a Valium to take effect, and so we'll just have you sit comfortably and let you be calm before doing anything to the eye. Once in the surgical area, one of our optometrists will double check the measurements that were done on your workup day. We want to make sure there's no changes. We want to make sure that everything is finalized and that I've had a chance as the surgeon to double check and even triple check the treatment that I want to do for your eyes. Once the pre-surgical workup's been done, we go right into surgery. The surgery is done in 2 different steps. The first step creates a flap. Traditionally, I use the intralace, and it takes about 2 minutes each eye to make that surgical incision. Once the intralace is finished, there's actually a small layer of bubbles in your eye, about 1/10 of a millimeter below the surface, and until those bubbles go away, we don't do the second step of the surgery. So we take people out to a little rest area where they can kick their feet up in a recliner and relax. It takes about 10 minutes for those bubbles to go away on average, and then we'll move into the second step of your surgery, where we apply the excimer laser. The excimer laser is different for each person who comes to see us. Some people will be recommended one laser over the other. Once we do the excimer laser, it only takes about 2 minutes an eye to do that step. So really, the time you're sitting down with your eye being operated on, under about 3 or 4 minutes each eye. Once the surgery is complete, we take you to the final area, which is an exam room, just to make sure that the eye looks healthy and stable and ready to go home and rest.